Hi everybody, I'm Dr. Brian Evans, Chief Medical Officer here at Tahoe Forest Health System. I've been a doctor for almost 30 years, and so other physicians of my vintage and I have actually never seen cases of measles, believe it or not, which I think is surprising to most people. And why is that? That's because, generally speaking, our vaccination rates for measles over the years have been excellent, and we really haven't seen many cases of measles at all. It's been generally pretty rare. But something has changed. We're now starting to see clusters of measles cases all around the country. We've actually had some clusters in Sacramento, Placer County, Shasta County, one in Washoe County, none in Nevada County yet, but we're expecting we're probably going to see some measles cases here as well. So what has changed? First of all, there's been a huge shift at the federal level in this last year. We're getting a lot of mixed messages about vaccines from the CDC, from the Secretary of Health and Human Services, and it's really quite a different stance than we've seen in the past. Also mentioned that the Advisory Committee on Immunization Practices, 17 members were all let go. They were all terminated last year. And these were people with deep scientific experience and expertise related to vaccine science. And so they've been generally replaced by people who are skeptical about vaccines. In addition to that, the federal government has suspended a lot of funding that would generally fund vaccine clinics and education so that people do go out and get the MMR vaccine, which contains a measles vaccine in it. All of this to say, there's been an erosion of public confidence, and we have seen our vaccine rates drift and go down across the country, including in our communities as well. We know that we're at risk for measles and other outbreaks in this community because we have so much tourism coming into North Lake Tahoe all the time. So what are we doing about this? Because we know measles can be very dangerous. It can be deadly for unvaccinated individuals. So we're getting busy here at Tahoe Forest, making sure that our teams are trained to recognize measles early, isolate quickly, treat complications, and get ready to do public health tracing for any individuals with measles and who they might have exposed. It's extremely contagious, so we really want to get on top of that. You should get busy as well. What we'd like to make sure you know is the most important thing you can do for you and your family is make sure you are vaccinated. So if you're unsure about your vaccination status or your child's, now is the time to get in with your physician, get in with your pediatrician, find out about your vaccination status, and get vaccinated, get up to date. It protects infants, it protects people who can't be vaccinated, it protects people who are immunosuppressed, and they really need all of us to vaccinate ourselves so that we can protect them. We care deeply about the health of this community. We're very concerned about the changes that have taken place with our vaccine status and the reductions of vaccination rates. And we know that we're very likely to see measles in our community. I'm concerned about it. Other physicians are concerned about it here. So let's do our part. Let's keep North Lake Tahoe healthy. Thank you.